Hello, I'm Dr. Alison Wallace and I'm a consultant clinical psychologist working in the Hampshire Isle of Wight Forensic CAMHS team. I'm going to present a short introduction to how to work with a young person when there isn't a clear evidence base for a specific intervention. So understanding a young person and their risk-taking behaviours when there's not a strong evidence-based intervention. Some queries or concerns can come into Forensic CAMHS when there isn't a specific evidence base for the presenting concern, meaning that research has not determined that a particular approach is best practice to follow. In these situations, myself and colleagues will draw on a number of theories and models, and these will help us understand the situation further and what might help lessen a risk or a concern. This might include theories such as the social learning theory or attachment theories. Within Forensic CAMHS, our aim is to understand risks to our young people and from our young people and look at how these risks can be reduced. We look to do this through understanding what motivates a young person in relation to risk-taking behaviours, how these behaviours can best be understood, and how we can best communicate that risk. This can be done by, firstly, understanding the function of the behaviour or what need is being met and how we can support change. By using a specific risk scenario tool to give some structure to help understand high-risk behaviours and situations. And then very clearly communicating risk using a risk statement. So understanding the function or need associated with behaviour and how we can support change. The functions or need associated with behaviour are relatively consistent across all of us. The way in which we meet them is what differs. If a need cannot be met by pro-social or adaptive ways, then it is increasingly likely to be met through maladaptive, antisocial or criminal ways, often increasingly leading to risky situations for young people. The needs that we are thinking about include having a sense of purpose. So what am I doing with my life? A need to belong. Who is my group? Where do I fit? Do I have friends that condone or condemn my behaviours? A need for security and safety, and this will include somewhere to live and money. A need to be good at something, so having a sense of achievement. A sense of mastery or being good at something might show itself as a hobby in a pro-social way, but might be an ability to break into buildings in an antisocial way. Both of these things can achieve a sense of being good at something and can be practiced to achieve a superior level of skill. We also have a need to have fun. Is what I'm doing giving me a buzz? Am I really enjoying it? And once we understand more fully, the question becomes, how can those needs be met without harming ourselves or others? It's also necessary to understand this in relation to the young person we're working with. So there's questions that can help us think about that. How have traumatic or otherwise adverse experiences affected this person's ability to get their needs met in a pro-social way? What are the barriers for them in doing this? How have the same experiences affected the way they look at the world? Do they think the world is fair? And can they do anything to change it or themselves? Or is their current behaviour the only way they can think to get that need met? Where are all the places that this person may experience ambivalence about what they might do differently? Currently, what's in it for them? What might they lose if they change? And this can include significant things such as friendship, status, or money. Within this context, we need to think carefully about the young person's motivations to change. Is the behaviour consistent with their own social, cultural, or family beliefs? Or would they be the odd one out if they acted differently? Do their own beliefs condone the behaviour? Do they think their behaviour is okay, and do those around them? Is a behaviour considered to be reactive or proactive? Any information about when and how it began can give insights into why now and why is it continuing. Gathering information this way can help understand both the risks, but more importantly, where change might be possible. In addition to understanding points for change, it's also important to be able to understand the risks and communicate those really clearly. For this, a specific risk scenario tool can be used. A specific risk scenario can be used to add structural detail to the behaviours that a young person is presenting with. The structure enables the use of professional judgment within a clear framework to support planning and risk mitigation. This will include: what are we specifically worried about? Including what is the nature of the risk? What does the risk look like? How severe is the risk? How frequently does the risk happen? And what's the duration? How much harm is likely to be caused? Is the harm psychological, physical, or financial? For example, frequent unwanted texts versus a single episode of violence. Imminence. Do we need to act now? Likelihood. Has this happened before? And are the same factors currently in place? What's risk enhancing? What, where, who, under what circumstances is the risk behaviour more likely to happen? Risk reducing. Again, what, where, who, under what circumstances can we reduce a risk? And if we're working with a young personal network, how will we know we're making a difference? What are we expecting to see that will enable us to see that? Who's going to do what? And what do we hope this will do? For example, if there are repeated incidents of violence after alcohol or drug use, part of the plan would be to reduce or stop alcohol or drug use. We also need to think about supervision. Does the young person need to be supervised for some or part of their time? For example, when there are factors that increase risks and they are currently present. Victim safety planning. Are potential victims aware of any risks to them? And do they need to be? And what might need to be in place for them? It can be helpful to decide what to do first and what is most likely to bring about change. And lastly, the risk statement. A short statement that is clear about what the concern is, who is at risk, and how it can or cannot currently be managed. This is a useful way to communicate concern within a network and can provide clarity for professionals, but also for the family and young person about what is making people worried. The risk statement will often mirror the headings used in the specific risk scenario, and it enables the network to share the responsibility of a risk and to determine what actions and escalations might be necessary. Understanding what might be driving a particular behaviour, what might be keeping a behaviour going, and what risk it poses is all necessary in working with the young person and their network. For more information on what Forensic CAMHS does and is able to offer, or CAMHS more generally, please visit the Hampshire CAMHS website.